I'm
Yes, ma'am.
Just tell me when I should begin.
I'm ready from my side. Only Rekha ma'am, if she started recording, we can go.
Yes. Yes, ma'am.
Yeah, you can start.
So, good evening, dear colleagues and our esteemed speaker, Mrs. Kavita Chandak, for yet another webinar on autism. Before we begin, I would like to present a small introduction about IWHP and the speaker to the audience. Yes. The iconic woman homeopaths of Bharat has begun as a visionary initiative by Dr. Vaishali Bide from Mumbai, and she, along with Dr. Rachna Srivastav of Lucknow, has created a group which, in a very short span of time, has today evolved into a powerful national women's group of over 1,000 strong, iconic women homeopaths from all over the country. The two young dynamic women leaders have come together to make a meaningful impact by bringing together like minded professionals who believe in giving back to the society. Our goal is to build a strong community where we support, uplift, and empower each other because women in medicine deserve more opportunities, recognition, and leadership roles. Adding depth and direction to this dynamic group are two highly respected and experienced mentors, Dr. Rekha Srinivasan from Chennai and Dr. Padmaja Rao from Hyderabad, whose guidance and wisdom have played a pivotal role in shaping the group's intellectual and professional journey. To ensure proper representation and effective outreach, 20 vice presidents of states have been appointed, along with two vice presidents representing two major metropolitan cities, that is Mumbai and Hyderabad. We also have an advisory board comprising of experienced and dedicated homeopaths like Dr. Geeta Mongia, Dr. Vaijayanti Nagarkar, Dr. Neelam Avtar Singh, Dr. Renu Mahendru, and myself, Dr. Alka Parvate, and there are many more. To tell you a bit about the speaker, Dr. Kavita Chandak. Yes, she is a 5 Golden Book of World Record holder for treating kidney diseases, mucormycosis, autism, and lupus nephritis. She serves on the advisory board of Turkiya Clinic Leri Journal, Istanbul. She is also on the board of directors at Afghanistan Homeopathic Medical Association, a life member of LMHI and IIHP, scientific committee member of Dues University, Turkey, and also a scientific committee member of LMHI 2022. She serves as a professor in the repertory department, PD Jain, HMC Parbhani. She is a guide for PG students in Nasik University, along with her practice as a homeopathy consultant over 2 decades. She is very well known as an international trainer, speaker, teacher, and promoter of homeopathy. And she has also received the first merit position in homeopathy in 1998. She has authored several books. Yeah, the list is too big for me to mention out here. And she has also delivered more than 35 national and international seminars and workshops with special emphasis on cancer cure, urinary disorders, autism and psychiatric disorders, kidney disorders, and dentistry, rehabilitation, and neurology. She has done a lot of social contribution along with the teaching work that she has done and has been given various awards for the same. Here too, the list is too big for me to mention. So over to you, Dr. Chandak. We are eager to learn from you. Please begin.
Thank you, Dr. Alka. We all are colleagues, so I am not a great person to teach you all anything. So you are not going to learn from me. In fact, we all are going to exchange our ideas today. Okay? So without wasting time, let me share my screen. And sorry for your inconvenience because I tried but I couldn't be on the Google Meet. So dear friends, our today's topic is about autism. Let me tell you first thing, those who are autistic are really genius and they are blessed because God has already sent them with the IQ more than 100. Today we have a case of autism on our board where I will discuss a case study in which I observed few changes. Can everybody please move? Yes, thank you. So today we are going to discuss a case. I have a lot of cases, more than 100, I would say, with ready presentation for autism and with different types. But this case is very near to my heart. And when Dr. Rachna called me few months back, I requested her that I am not able to be, on board till November. So please contact me after November. And hats off to her memory. She actually contacted me in December, just 3 days back. And I thought, let us take it in a working day. So today I will talk about a case, and I'm really grateful to homeopathy, who saved a frustrated mother's life and a child's life. When a child having autism is there in the family, it's really difficult for the family to handle this child because it is not just the child who is suffering, it is the whole family who is suffering. And when we provide the relief to such cases, definitely the quality of the life improvement is there for the whole family, and you get the immense pleasure and job satisfaction. A mother consulted me for her 2.5 year son. He was a diagnosed case with autism and ADHD. Let me tell you that autism cases, whenever you will always get ADHD with the autistic cases. I hardly saw or experienced only 2-3 cases out of my 400-500 cases where actually I didn't get ADHD. Otherwise, you will get autism either with ADHD or ODD or conduct disorder like that. Something will be there. The initial consultation was this. This child was 2 years when he got the diagnosis. And you can see here, the diagnosis was done, pervasive developmental disorder. It is one of the type of autism. There are different types of autism, Asperger syndrome, PDD, PDD, as well, we call autism or different types now under one umbrella diagnosis. They all are known as now autism spectrum disorder. So what we call them today is ASD. His birth history, he got premature birth, born 3-4 weeks early due to mother's bleeding, requiring cesarean section. Birth weight was good, 3 kg, with pediatrician warning of potentially sluggish development. The pediatrician already told parents that, the child may be sluggish or maybe having some delayed development. Then early development couldn't be breastfed due to lack of milk, though dentition and walking were normal for the age. So he attended few milestones normally, like walking and dentition, but there is a huge but in all autistic cases. And this but is speech issue. You see, 90% autistic cases are non-verbal autistic patients. Only 10% are there who can talk. He can utter papa, but doesn't understand the relation. Just a word to him. Doesn't call mother as a mom. Points to objects instead of speaking. This is a very good comfort zone for our autistic children. They learn signaling and they keep on do that. And whenever you solve their issues, I have lot of patients where I, started their speech. They are converted into verbal autism from non-verbal autism, but they do not prefer to talk. This is one of the characteristic feature of autism. There is aversion to talk. They cannot talk because they are already in their comfort zone and they do not want to break it. So this child who was already non-verbal autistic points the objects instead of speaking. Could talk until 18 months, then gradually lost speech. You see, in pervasive developmental disorder, This is a typical thing. You will see the child is growing well, all the milestones are normal, and gradually, one day, the parents start observing the regression of the child. And they gradually observe that nowadays my child is not talking. What happened? Is all, progression is now landing back into the deterioration. So, this child was also able to talk till the age of 18 months. And they have very selective responses. Sorry, please mute your microphone. Can everybody please mute the microphone? They have very selective responses. When he was 2.5 years old, relatives told the mother that he was not responding well. And that time mother thought the child must be deaf. So they went to the doctor and they performed this audiometry, which came normal. She said, if we call him by his name, Shaurya, he doesn't respond. If I ask something interesting to him, he answers. For example, if I ask him, Shaurya, do you want chocolate? He says yes. So he understands well, but only the things which are quite interested for him. And there is different behavioral patterns. No fear and no responses. No response about the fear. He is courageous in the inappropriate situation also. Dr. Alka, could you please request them to mute their microphone?
Whoever's microphone is on, please mute yourself, everyone. Please mute your microphones. There are 41 participants actually. Yeah, I think she has muted it.
I muted them.
Yeah.
Okay. So we are back. There was no response to the fear. Mother said he was laughing during thunderstorm. There you will see, usually the children get scared because of the loud sound of thunderstorm. But this child did not respond to the fear. And he doesn't understand risk factor. He is quite restless, cannot sit at one place, and does not sleep properly. There is excessive jumping. Sometimes he jumps 1,000 to 2,000 times per day, which is a very obvious characteristic for the autistic children. They have very attention-seeking behavior, jumps in bed for hours, wants others to watch and clap, cheer for them. There is desire for appreciation, prefers open spaces, throws things, potentially hurting people, teasing people, and more comfortable with men than women. That is also very typical clinical symptom of autism, which I observe in my practice. They are always comfortable with the same gender and they are quite uncomfortable with the opposite gender. It's not like a fear of opposite gender as we see in pulsatilla, or there is aversion to opposite gender as we see in sepia. It is something different. It is about comfort zone. Lack of response, doesn't respond when called, cannot express his needs, only confirms when asked directly, and passes too lean panty, cannot unbutton the pants. So cognitive development was not good as we now understood. And they are quite possessive and destructive behavior in general also. About this child, he becomes destructive when things go against his wishes. Anger, contradiction. He tears paper, broke TV set, bites his sister if she approaches mother because he feels that she is only my mother. You see, feeling of jealousy. There is a slight difference between jealousy and envy. Envy is that if somebody has some good qualities, I should also have this. This is envy. But what is jealousy? Jealousy is more about me and mine. Oh my God, my mother. my wife, my position, my bag, my school, my lecture, my people. When there is everything is my, you can consider the rubric jealousy. Sleep pattern. His sleep was quite restless, constant movement in the bed, sucks thumb when seeing the blanket. As soon as he sees blanket, he starts sucking the thumb. You see, when mother told this symptom, immediately one sarcode or body on substance came into my mind. That is placenta. Placenta remedy has this typical symptom. When they sleep, they wrap the whole body with the blanket. They wrap from head to feet. And usually they love to spend their private time in their blanket. But this is not our placenta case. Sometimes put a blanket on his sister's body and sleeps on it. So he loves to play with the blanket. There is irritability and he has his own preferences. Obviously, because autistic children are highly stubborn children. So they follow what they want. And there is no acceptance for the changes because they have fixity of the mind. Irritable behavior, bangs head on floor when contraindicated, cries for hours, enjoys spicy food, which is common for all autistic children in my experience because they have very good taste buds. Loves playing in water, even watering the plants in the garden in his home 15-20 times per day. Digestive issue was there. Stool is occasionally hard, mother said. Drink small or large quantity of water even during sleep. Vertex and forehead sweat a lot. Neck is wet upon waking. About family history, eldest sister is quite normal and her all milestones were normal. Father is introverted person, talks to himself and lacks confidence. Now meet the mother, and while meeting the mother, this case is already subtitled and we all are, only one Russian delegate is there. Otherwise, we all are Indian delegates, so you can understand Hindi also. Now, just see the video and meet the child. त्याला जे करायचं ते करू. अगदी रिलॅक्स. नाही माझ्याकडे पोरं येतात त्याच्याकरता ते एन्जॉय करतात. मला खूप आवडतं पोरं खेळलेलं. तुझ्या भेटत आहे.
पहिल्या मुलीने खूप त्रास दिला होता. ती बदमाश होती तर मला बाळ नकोच होतं.
अच्छा.
पण घरच्यांच्या प्रेशरमुळे मी दुसरं बाळ घेतलं.
जबरदस्ती तुझ्या मागे लागली की तू प्रेग्नन्सी ठेव.
तर मग मी विचार केला की बा हे कसं भूत वेताळासारखं आपल्या मानेवर हाकललं तरी येऊन बसतेच. एकदाच सेकंड चाईल्ड करून जे होईल ते पाहून घेऊ बा असा विचार करून मी म्हणजे आपण कसं म्हणतो डोळे बंद करून विहिरीत उडी मारतो तशी विहिरीत उडी मारल्यासारखी केली. ऍक्च्युली हा मुलगा झाला मला खूपच नाराजी झाली. मला मुलगी पाहिजे होती.
But already you had one daughter.
हा पण आणि मला मुलं आवडतच नाही.
त्याला कारण
का माहिती असं वाटते की मुलं चांगलंच नसतात.
Did you observe that this lady, she was not agreed for the second pregnancy. She already had one daughter, but family forced her. And she said that Dracula was sitting on my neck and I had this pregnancy. I kept this pregnancy just like jumping in a well. So this was an unwanted pregnancy. The child was one rejected child during pregnancy also and even after the birth. Because the mother herself told me that I did not want the male child. She wanted the second daughter, but she did not want the male child. I asked her about her emotional state during pregnancy, and she said, I was not happy, not sad, just neutral. So, and he was going to the occupational therapy, and these are the reports from the occupational therapy. There was delayed speech, selectiveness in response, and solitary play, which were, these are the typical symptoms confirming autism. And he had issues with the general processing, visual processing, and oral processing. This means that perception was good, but when they perceive anything, they cannot comprehend it. The mind cannot give them the command how to react to a particular. So he had such issues. Now, what should be the homeopathic approach at this moment? Now you have all the case with you. Homeopathy treats the whole person, considering physical, mental, and emotional aspects to find the most suitable remedy. You see, we work with holistic approach by covering the holism. First holistic approach is HOLISTIC, and second holism is WHOLISM. So we work with holistic approach by covering the holism. Now, how to approach in this case? First of all, I covered few mental rubrics. I covered mind, speech inarticulate, mind, taciturn, mutism in children, fearless, children, jumping in children, desire to be flattered. You see, I will dance and you just clap for me. Cannot express oneself. Expression is difficult. Anger from contradiction, possessiveness, irritability from slightest contradiction. Few physical rubrics and general rubrics also I considered here. Desire, water, love for water from mind chapter. Impulse to jump, jumping. Perspiration on scalp from the chapter head. Neck perspiration. Thrust, extreme thrust from the chapter stomach. Stool hard. You see, constipation is a very, very common symptom present in 98% autistic children. They have restless sleep, especially this child. So I considered the next rubric, restless sleep due to bodily restlessness, desire for spicy food, and when you search the rubric hyperactivity in children in repertory, I use synthesis 9 repertory treasure edition. And when you search this rubric in this repertory, the repertory redirect you to the general chapter and you get the rubric excess of energy in children. So I gathered all these rubrics now. And many remedies came up with this repertorization. For example, I had sulfur, phosphorus, agricosmus, tarantula his, ignitia, sepia, lycopodium, and stramonium on the board. Now it is your turn to answer me with which remedy should I proceed and why. Yes, doctors, come on. Dr. Alkachi, kindly read the chat for me.
Ma'am, someone has suggested agaricus,
Very good. Thank you.
tarantula,
Hmm,
sepia.
very good. Why sepia?
Can you please mention the reason, Dr. Mamta? Why sepia?
Dr. Mamta, you can use your microphone also to answer.
She says aversion to opposite sex.
I already explained this point, isn't it? There is no aversion to opposite sex or there is no fear of opposite sex. It's only about the comfort zone. Any other answer, Dr. Alkaji?
No, ma'am.
Dr. Lesan, are you there?
Someone has suggested sulfur for hyperactivity.
Very good. Thank you. See, the remedy selection is always a challenge. And if you have such, remedies which are polychrist and you are going with them in autism, you will only could satisfy few rubrics or few symptoms, but you won't be able to treat the autism because treating autism is not easy. It's a difficult task. For that, we need a different strategy. None of the common remedies covered all the important rubrics. So when we do not have any remedy covering all important rubrics, what do? We usually go for nosors and we cover nosors were considered, but in this case, It is ruled out because there were no history of toxin exposure during pregnancy. To prescribe Nozod to clear the imprint on the immunity, the imprint of toxin, you need a proper history of, lot of toxin exposure. Maybe antibiotic, maybe anti-allergic, maybe radiation, maybe lot of medication, drugs, alcohol, anything in the mother during pregnancy. But in this case, there was nothing. So I was not able to prescribe any Nozod in this scenario. Now, what should be the analysis at this moment? During interview, I understood that I am talking to a disappointed woman who bear this child against her will. You see, the mother was not ready for this pregnancy, and this child was unwanted pregnancy. Whenever there is augmenting factors from the rejection, which remedy knocks your breath? When you know the child was rejected. Yes, any answer? Dr. Alka, are you there?
Yes, ma'am. Matt Muir is the remedy which has been suggested. Someone has even spoken about Natramure and Ignatia.
Very good. You see, magnesia group is always knocks your brain when there is augmenting factor from the rejection. And as mother said that I did not want this child, but she came to visit me. No, she could not accept the child as a boy also, even after delivery. But today she came to meet me with her autistic child with a ray of hope. She is optimistic in spite of lot of negativity or negative symptoms in the case. My need was
Someone has also suggested, ma'am, sepia, as the mom had no emotions.
Okay, thank you so much. Thank you. Ma'am has, mom has emotions, but she did not want only the boy child. Actually, she did not want the second pregnancy because her daughter was very naughty, which she explained in the video that my daughter troubled me a lot. That's why I was not able to have the other child. The challenge, you see, in this case, at this moment, my need was a remedy which should cover child's present complaint and mother's symptom before and during pregnancy. Now suggest me the remedy where you can see the child's complaint also, the present symptom, as well. You can see the mother's mental status during pregnancy. Is there any remedy? So please tighten your seat belts now because we are going to learn a very good remedy today. I prescribe this remedy, Falcon peregrinus 1M. This is a bird remedy. Why I selected this remedy? You see, whenever we have any remedy on, we should justify this remedy. Actually, Falcon stood on 50th number in my repertorization chart. When I applied the filter, graphical results by strategy in radar software, Falcon came up along with the anacardium and aurum remedy in small remedy. And that is how I found this remedy Falcon. Now let me tell you why I chose Falcon. If you can see here, we have all the rubrics here in the repertorization chart, and this is graphical filter in radar software. In small remedies, you will see Falcon is present on 6th number. Falcon peregrinus is known in homeopathy for addressing symptoms related to detachment, communication difficulties, and hyperactivity, all present in this case. These all symptoms were present in this case. Usually, polycryst remedies cover many symptoms in each patient, as they have multiple symptom banks. Small remedies cover those symptoms which are the unique symptoms of the individual. I chose Falcon as it was the most suitable match to mother's and child's symptoms. A long experience with autistic cases taught me that while dealing autism, we must see the reflection of mother in child and vice versa. So, the image, the child's current symptom, and the mother's mental and emotional status during pregnancy must be a mirror image. Then only you can prescribe any remedy in autism. Now, let me justify you these two symptoms and why I chose this Falcon remedy. Always remember, Polychrist talks about the common symptoms of diseases, and small remedies talk about the unique symptom of the patient. And in homeopathy, we do not treat the diseases. We treat the person in the disease. Understood? Now, see the mother's symptom when she was pregnant, which I observed and got in Falcon remedy. There was a delusion that she is trapped. Because, she didn't want this child, but she was trapped by her own family. So there was delusion that she is trapped, delusion that she is betrayed. Because, she got married with a man. Before marriage, the man and his family hide his original age and original salary from the girl's family. So she felt that I was being betrayed. Elements from suppressed anger. During whole pregnancy, she was very angry because she did not want this second pregnancy. Elements from shame, elements from being scorned, contemptuous, delusion, he is persecuted. She told in her video that I felt like some Dracula is sitting on my neck. So I have been persecuted and unwantedly I had to carry this pregnancy. So there were no option or no solution and no escape. I was trapped, I was persecuted. Delusion, unsupported. Husband was not supporting, of course. Injustice, she cannot support the injustice, but cool in the face of injustice. She said, I cannot support the injustice, but now during their pregnancy or before the second pregnancy, she had no option except keeping the unwanted pregnancy. That's why I considered this rubric here. Injustice cannot support cool in the face of injustice. Though cannot support injustice, but has to keep the cool face, has to suffer that injustice without any desire, without any willingness. Loathing of life, loathing oneself. But though she is unhappy, but still she was positive and she came to visit me because she felt that homeopathy can cure her child. So I consider this rubric optimistic in spite of the weakness and telling the plain truth. She told me everything plain and honestly she talked everything about her family. So I found that she is very nice woman. Falcon P are courageous patient, strong and extremely agile birds. There needs to be more freshness and more air and space around. They always want, openness, open surrounding, more freshness and more space nearby them, which in this case, the lady who was pregnant didn't got. And that's why I considered this rubric Falcon P remedy here. And we have these rubrics from this remedy. Now, let us match these rubrics with the child's current rubrics. If they both are matched and you get the correct picture, then only you should proceed in autistic cases. It's not easy to prescribe just tarantula, stramonium, belladonna, like remedy, hyoscyamus remedy or tuberculinum. No. If you will keep on prescribing such remedies, you are never going to get the cure in autism. You will get partial results, but not the cure. Now, let us see the child's symptom. Anger from contradiction, biting, concentration difficult, cannot fix attention, lack of reaction to danger, no sense of danger, depersonalization is there because he was lost his own world. As we see, Swati madam, you are drawing on my screen, please. And longing for good opinion of others. Rage with biting, restlessness, from the mind chapter, taciturn and loves water. So these rubrics from the child, the symptom of the child were present in Falcon remedy. I gave him Falcon remedy 1 1 dose and now see the follow-up after 3 months. There was follow-up between, every month she used to visit me, but I did not change any remedy between this time and now see the follow-up after 3 months.
पहिले कसं हो म्हणता येत होतं
हा
आणि त्याला जर करायचं नसेल तर तो शांत राहत होता. आता तो नाही म्हणतो.
नाही म्हणतो म्हणजे त्याला जर करायचं नाही तर त्याला समजतं की म्हणजे नाही बोलणार. तू 3 शब्दांचं काही सेंटेन्स येतं का त्याला?
एकदा बोलतो तो फक्त मी बाहेर जातो.
म्हणजे आता त्याला सेंटेन्स मेकिंग यायला लागलेलं आहे आणि कोणत्या वस्तूला काय म्हणतात ते पण कळत आहे आणि सोबत त्याचं नाव किंवा स्पीच क्लिअर झालेलं आहे. This is the change after 3 months. Now, what should be the prescription at this moment? Should I give the placebo? Should I repeat the same remedy? Or should I choose some complementary remedy? Because one wrong prescription and you will lose your patient, and patient will lose his faith in homeopathy. Yes, please. Any answer, madam?
Placebo, ma'am.
Placebo is the thing suggested by many.
Yes, correct answer. Yes, I just gave the placebo. Now see the follow-up after 6 months. He still plays in water. If I try to pull him out, he relaxes his body, becomes loose, and then throws out the things, mother said. He wants to plant water 10 to 15 times so that he can stay in water. And I asked mother again once to repeat her pregnancy and delivery history. She said, my son was born with cesarean section. It was a breech presentation. His neck was surrounded by an umbilical cord. Why did I ask the mother to repeat her pregnancy and delivery history? Any clue?
No answer as of now.
My dear friends, the child loves to play in water. And this is a restless child, autistic child. I think somebody answered. Anything in chat? Yes, Dr. Alka?
No, ma'am. Just a
Oh.
minute. Let me just see. Just let me go through. Yeah, fish remedies. Dr. Rekha has suggested fish remedies.
Like sepia?
Ma'am, could you name the remedy? Rekha, ma'am, can you name the remedy?
Yes, which remedy?
Yeah,
Dr.
she doesn't have an idea about which exact remedy, but it looks like fish remedies or matridonal remedies. That's what she has to say.
Exactly. Rekha madam, you are partially correct and partially wrong. Because first of all, my question was, why did I ask once again about her pregnancy and delivery history? I didn't ask about the remedy. I asked this question because, the child was crazily playing and loving the water. And I asked this question because I wanted to confirm about oligohydroamnios as the remedy amniotic fluid stuck in my mind at this moment. So, Rekha madam, you were partially correct about matridonal remedy because after hearing this symptom, amniotic fluid remedy came into my mind, and that's why I cross-checked about oligohydroamnios. But fortunately, it was not there, so I did not prescribe this remedy. Now, at this moment, what should be the prescription?
Dr. Hetal has said amniotic fluid,
But
or can it be umbilical cord vernix caseosa, as suggested by Dr. Rekha?
Mhm. But we are not talking about the remedies. I just explained that why I asked this question at that moment because amniotic fluid remedy came into my mind, and I wanted to clear whether the woman had oligohydroamnios during pregnancy. But it was not there. No oligohydroamnios or no polyhydroamnios. So I couldn't prescribe this remedy. We need to justify every remedy before prescription. So now at this moment, which remedy should I give her? Give the child? Simple. I just prescribe Falcon P remedy. Again, 1 m, 1 dose, but in aqua dose this time. Aqua dose means I suggested the parent to put one pill in just half cup of water, stir it well, and give the child to drink at once. This is one aqua dose which I use in my practice. Now, you will see here the psychological assessment. After all this treatment, after 7, 8, or 9 months treatment, I suggested the parents that they should go and do CARS. It is, childhood autism rating scale. The total score on CARS came 29. Severity of autism was minimal to mild. Minimal symptom means almost no autism. CARS score none to minimal is 15 to 29. Now see the follow-up after 8 months. Initial consultation, when the child came with diagnosis of autism and ADHD, Falcon P 1M was prescribed. After 3 months, initial improvement was observed. I gave the placebo. After 6 months, continued water fascination, but other improvements noted. So I gave once again Falcon P 1M 1 remedy, and that's all. But that was aqua dose. Then after 8 months, the further assessment of progress and treatment response was good. Now see this video when she met me after 8 months.
आम्ही जेव्हा टेस्ट केली यांची कास्ट टेस्ट तर तेव्हा तो त्या सरांशी रिलेट केलं त्यांनी क्वेश्चन आन्सर विचारले सरांनी तर त्यांनी सांगितले तो बसला पण अर्धा तास बसला आणि कसं सर म्हणत होती की हा पहिला पेशंट आहे का ज्याने इतक्या लवकर इम्प्रूव्ह केलं पण मी त्यांना नाही सांगितलं की मी होमिओपॅथी देत आहे म्हणून.
You see, when the therapist appreciated the child for sitting long time, although he is in autism, but the mother didn't tell him that she is giving him the homeopathic treatment. Our job is thankless job.
आणि सांगितलंच
नाही मॅडम सांगितलं नाही मी त्यांना.
बरं पण त्यांना एकदा सांग सोनाली की आम्ही याच्यासोबत होमिओपॅथी सुरुवातीपासून दिलं म्हणा जवळपास 6 महिन्यापासून आम्ही होमिओपॅथी देता म्हणून सांग त्यांना.
कॉम्युनिकेट करायला लागलेला आहे म्हणजे
The father first time contributed in this case, and he said, now my son is understanding everything, discussing anything, and now he is putting his own input. But mother didn't tell the therapist that she is taking homeopathic treatment for her child. Now, at the moment, what should be our prescription and why? At this stage, a critical decision needed to be made regarding the continuation of the treatment, because everything is really going well. If I will go with the placebo, maybe I can delay the recovery. If I will go with medication, it could be the overdose. If I change the remedy, it may not give the same response as Falcon gave. So what to do? Usually in my practice, in autistic cases, after 6 months, it really becomes difficult what to prescribe. but I always prescribe with the help of Nyasa. And due to that, with the grace of God and Hanuman, I always get good results. So at this moment, I just I just gave placebo. A placebo was prescribed, indicating that the original remedy was still working and no new intervention was needed. And trust me, placebo is not just a placebo as the other schools are calling or saying about homeopathy. They say that what you give, fear, only sweet pills. Ah, that is placebo. Homeopathy is a placebo. No. Placebo is the dynamic bond of trust between the physician and his patient. So if you even prescribe placebo from the day one till the end day of recovery to the child, not a single remedy, till your child can get, recovery, only if the parents trusted you so much. So placebo is a dynamic bond between physician and the patient. It is not just sweet pill. Now see the follow-up after 11 months. Till then, we have given one remedy only 2 times, and that's all.
सोनाली, अभी अपने को इसको दवाई शुरू करके काफी महीने हो गए बेटा, यानी तकरीबन एक 10-11 महीने तो अब हो गए हैं. तो तुम शुरू में जब आई थी तब इसके बालों का भी एक प्रॉब्लम था. क्या प्रॉब्लम था बता.
त्याची केस अशी प्लास्टिक सारखी वाटत होते, असं वाटत होते की नकली आहे.
अच्छा.
You see, in many of the autistic cases, we do hair analysis to diagnose autism because their hair contains heavy metal, and that's why they look like plastic, and they shine and look like artificial things, not exactly like natural hair. And it was the complaint which she mentioned me after 4-5 months of treatment.
कोणाला वाटेल की टच करून पाहिलं की प्लास्टिक आहे बा असं वाटत होतं.
अच्छा.
आता त्याचं पुष्कळ म्हणजे 90% केस चांगले झाले.
तर आता तू टच करते केसांना कसं वाटतं.
म्हणजे थोडे सॉफ्ट होत आहे.
आता नॉर्मल दिसतात केस.
नॉर्मल दिसतात.
बस. स्पीच कैसा है उसका अभी.
स्पीच खूप चांगला आहे.
सब बोलतात.
हो सगळं बोलतो.
खाणं माणं मागतात.
हो सगळंच मॅम बनवून मागतो. हे नाही पाहिजे ते पाहिजे त्याच्यासोबत ते पाहिजे लोणचं दे पापड दे.
ओ माय गॉड.
सगळं पाहिजे असते. मिरची तळून दे.
अच्छा यानी खाने का पूरा सेंस है.
हाँ पूरा
Okay.
सेंस आहे.
You see, we never planned any remedy on the hair, but still we got the changes in the hair. If your remedy is appropriate for the patient, not for the disease, then only you can get the complete transformation of the personality. Now tell me what should be the prescription here. Everything is going well. So better to prescribe placebo. Now see the treatment results after 11 months like that. Communication, significant improvement in speech and ability to express needs. His hyperactivity got reduced, less jumping was there, improved social interaction, more restless sleep pattern with less restlessness. He was sleeping well without any melatonin or magnesium prescription. As you all know that I'm working internationally. Every country has different protocols and different way of working. So there is one country where they use melatonin for their children if the child is in autism, ADHD or schizophrenia, so that he should get a proper sleep. How you can create a proper sleep in a patient by inducing sleep every day by melatonin? In America, there is a tradition to take magnesia before sleep just for good sleep and relaxation of muscles every day. If every day you will take medicine for anything, you are inducing that particular thing, and in that way you are losing the natural centers of the sleep or muscle relaxant in the body. So please do not do these things. Go with proper anti-miasmatic remedy which can really help you. Better toileting awareness was there in the child and ability to manage basic self-care. Now see this video and see the overall changed look of the mother. In the first 1 or 2 videos, you must have observed her dressing sense or happiness or sadness on face. And now see the total transformation even in mother. I didn't treat her. I only treated her child.
सोनाली, सबसे पहले तो ना मैं तुमको कॉम्प्लीमेंट दूंगी कि आज तुम बहुत सुंदर दिख रही हो। मेरे को लगता है बच्चे का ऑटिज्म का तेरा स्ट्रेस अभी खत्म हो गया है, इसलिए तू अच्छी दिखनी शुरू हो गई। चलो अभी मुझे बताओ कि इसमें नया क्या इम्प्रूवमेंट है।
मॅम म्हणजे तो खूप हुशार झाला. म्हणजे तो कोणाला टीज करतो काही करतो पण पकडलं नाही जात.
ओके.
असा करतो आणि त्याचं कसं बिहेवियर वगैरे वाढलेलं आहे, चांगलं झालेलं आहे. आणि त्या कळते कुठे काय केलं पाहिजे.
टीजिंगचं एक एक्झाम्पल दे मला.
म्हणजे तो ना क्यू मध्ये उभा होता, तो नाकातलं शेंबूड दुसऱ्याला लावत होता केसांना. त्याने मागे बघितलं तर तो असं बघतो की मला माहितीच नाही कोणी लावलं.
अच्छा.
हा म्हणजे तो म्हणजे टोटली निघून जातो आणि त्याला क्वेश्चन्स वगैरे पण कळतात, डिमांड कशी करायची, कुठे घेऊन मागायचं, काय नाही करायचं ते पण कळतात.
त्याला पैसे समजतात का?
हो, पैसे कळते, त्याला पैसे द्यावे लागते, पैसे कमवावे लागते पण कळते.
ओके, व्हेरी गुड. चलो बघ सोनाली, आपण याचं 16 ऑगस्ट 2021 ला ट्रीटमेंट सुरू केलं आणि आज जवळपास किती आहे, 21 नोव्हेंबर 2022 आहे. त्या दरम्यान खूपदा तुझे गॅप पण झालाय, तर त्या हिशोबाने आपण एक्झॅक्ट 1 वर्ष समजू आज.
नाही मॅम, तो आता टोटली नॉर्मल आहे.
This is the happiness of the mother. But, you know, always there is a different or second side of every coin. I will share her old video with you and you will come to know the sufferings she experienced in her life when her son was in autism. But before that, I will explain you this takeaway. The patient is still under my medication. I just prescribe for the acutes. And it is important to know where to stop in homeopathy because the homeopathic medicines can create disorder that it is efficient to cure. So we need to stop somewhere. Do not keep on prescribing so many medication. As much as you prescribe less medication, your success rate is always on the high, on the top. Now, listen this truth from the mother, what she suffered, and you know, you will have the tears in your eyes when you will listen her. I just took this video one day when she just came for the casual follow-up consultation. And I usually follow up my all children for years. I do not insist them to take the medicine, but I only suggest them to come and meet me every once in a 3-4 months. That's enough because we need to keep this checkpoint whether the autistic symptoms are coming back or not.
बेटा, अभी तो आपका बेटा ऑटिज्म में ठीक हो गया सोनाली, पर जब ये ऑटिज्म में था आज से 1 साल पहले, तब तुम्हारी क्या फीलिंग्स थी उसको लेकर?
मला तर कधी वाटलं नव्हतं का हा ठीक होईल. आणि मी थेरपीला जायचे, तिथे पण कोणी ठीक झालेलं नव्हतं. तर त्याच्यामुळे मला काही अशी अपेक्षा नव्हती आणि सर पण म्हणायचे नाही की बा ठीक होईल, ते कधीच म्हणत नाही. ते फक्त म्हणलं की तुम्ही थेरपीच करा.
पण तुला स्वतःला काय वाटायचं की
मला
मी काय
असं
करू?
वाटायचं की मॅम सुसाईड करणं हाच एक उपाय,
स्वतः सुसाईड करणं.
स्वतः त्याला घेऊन, कारण की मी नसल्यावर त्याला कोण बघणार आहे.
तर त्याला कसं मारायचं असं तुला वाटायचं?
मी खूप वेळ विचार केला की त्याला पकडून मी दिली दिली माझ्या, कारण की त्याच्याशिवाय पर्यायच नव्हता माझ्याजवळ. का हा ठीक होईल, मी जर सुसाईड केलं तर त्याला कोणी पाहणार नाही, त्याचं लाईफ खूप खराब झालं असतं.
पण या विचाराचा तुझ्यावर काय परिणाम झाला?
भयंकर मानसिक ताणातून गेली मी, भयंकर टेन्शन मध्ये. मी झोपली तरी मी माझ्या डोळ्यातून अश्रूच पडत जायचे, पूर्ण उशी येऊन जायचे.
आणि स्वप्नात काय बघितलंस यावेळी?
का स्वप्नात मला सगळे जायचं की शोधून म्हणायचं मम्मी मी माझी काय चूक आहे, म्हणून मला इतकं धक्कन व्हायचं की मी माझ्या बाळाला कसं मारू शकते असं वाटायचं.
तुझे ते बोल के मुझे डरा दिया बेटा.
नाही मॅम, खरी गोष्ट आहे. आणि या त्रासातून जो जाते ना, त्याचा तुम्ही पेन विचारच नाही करू शकत, करूच नाही शकत. तुम्ही ट्रीटमेंट करून ना म्हणजे खूप मोठी गोष्ट आहे.
चल बेटा, थैंक यू. और ऐसा थॉट अभी लाइफ में कभी दोबारा नहीं लाना.
नाही मॅम, त्याची गरज नाही.
Whenever I share this video in my presentation, anywhere, in any country, I always get goosebumps. This is the pain. You know, this mother wanted to commit suicide along with her son because she was so much frustrated due to his autism. And now The child is so outspoken, extroverted, speaking everything, asking such questions. He's highly curious. One day he came to my chamber with his mother and he asked me, he saw lizard in my chamber and he asked me, Dr. Auntie, can I climb on the wall like the lizard is doing? Why she is not falling? If I climb on the wall, will I fall or I will be able to climb like a lizard? And I was speechless. How to answer such question? See, every child has a divine potential. We need to unveil it. And this is what I am doing since last 27 years. The key principle for the treatment should be our treatment must be holistic. When I use the word holistic, I mean HOLISTIC, holistic as well. WHOLIST, holistic means holism, complete personality, not just few symptoms. Do not treat the disease, try to treat or address the patient under the disease. We need to keep patience, allowing time for the remedy to work without unnecessary intervention. Do not prescribe remedy one after one. Wait and watch. And actually, if you need that, yes, this is the time to prescribe the remedy, then only prescribe the medicine. Because every medicine has a huge potential to transform the person. So please use it, don't misuse it. And carefully monitor the patient. Do the regular follow-ups to assess progress and make adjustment as needed. This case demonstrates how homeopathy can address complex developmental conditions through individualized treatment. And this case got published in hpathy.com in 2024. I'm really thankful to homeopathy. Homeopathy not only saved the child, transformed his personality, but it has totally pulled the mother out from her frustration. You might have observed the smile on her face in the second last video. These are my books about psychiatry available on my site, drkavitachandak.com, or you can order it from Amazon. These are the books, Health versus Disease, about depression, about schizophrenia. Homeopathy is fun, dedicate and learn. Homeopathy is logic and magic, like that. This is the most and the bestseller book, Healing Woman with Homeopathy, in medical world today. This book is now published in Czech Republic language as well in Russian language. And now it will soon appear in Turkish language. Thank you so much for your patience listening. Thank you for this invitation. I'm really sorry. I actually wanted to make a huge presentation for 2-3 hours so that I can share 2-3 cases with you. But time frame and I couldn't spare that much of time. But maybe next time I will come and will come with different type of autistic cases. Autism has different types which I clinically diagnose, and I have launched my 4C method to deal with autism in LMHI Colombia 2023, where I was invited as a keynote speaker. I delivered a session there about how to deal autism with homeopathy, and there is a speedy recovery. You do not require 2 years, 3 years, 4 years to treat autism. You require max to max 1 year to treat autism with the 4C method. So this is all about today's presentation. If you have any question, kindly ask me. I would love to answer. Thank you, everyone.
Yes, ma'am. In the chat, someone has asked, what is the importance of karyotyping in autism?
What is the importance of?
Karyotyping.
Can you elaborate this question?
This question has been asked by Dr. Sneha. Dr. Sneha, could you please put forth your question in the group? Dr. Sneha? I think she means genetic testing.
Okay. Dr. Sneha, this is a $1 million question. I was expecting this question. Thank you so much. Let me explain you one thing. Autism is not a genetic disease. So genetic testing doesn't matter at all. Autism is an epigenetic disease where you will see the traits in the child, but the parents are absolutely normal. So it's not a genetic disease. So there is no need of genetic testing. And with genetic testing, you cannot rule out the epigenetic disease because autism can also happen due to the triggering factors coming from environment. For example, from vaccination, from radiation during pregnancy, from drug intake during pregnancy, like that. Not only because of the emotional status disturbance during pregnancy. So it's not a genetic disease at all. Any more question?
Ma'am, here I would like to ask a question. Today itself, I saw a patient in my clinic who was having delayed milestones, especially delayed speech. Okay.
Right.
And certain features like biting or hitting other children at a very young age, around 1.5 years. He's around 2 years, 2 months right now. And uh, it is not confirmed whether he is autistic. So, should we, if such a kind of patient comes to our clinic, is it necessary that we go in for the CARS evaluation, or should we wait and watch with the remedy? And then, if the patient is still showing signs or whatever, we should go in for further testing. How do you go about it?
You see, first treat with the medicine, wait and watch, because delayed speech and biting and troubling others is not a accurate symptom of autism. We need a lot. There are 36 symptoms of autism. OCD is a typical symptom of autism. So there should be some obsession in your autistic patient. This is the
For example,
any obsession. They can carry their own towel everywhere. They play with only one toy. They love to travel only one road. They want to buy fruits only from the same shop. They can wear the same t-shirt even though it is teared. They will, stress the mother that you should stitch it again and I will wear the same thing. So always OCD in autistic patient. Then there are a lot of sign and symptoms. I usually explain lot of sign and symptoms with the case example for every symptom in my detailed session, in my international session. So here I couldn't explain, but there are so many symptoms of autism. Not only this is very small thing. Only speech is delayed. All other milestones are normal. So wait and
yes.
plan the remedy. When you have only speech delay, nitramur is the best remedy. When you have speech delay along with walking delay, Baretta tuberculinums are the best remedy. When you have all the milestones are delayed, like speech, walking, dentition, all the milestones are delayed, then the best remedy is agaricus mass. So think like that, in that way. And I think you can satisfy all these symptoms with these remedies. But if you feel that you are getting some more aggression, and one more thing is that autistic children do not have simple aggression. They have violent aggression. They can break TV, they can break laptop, they can throw the mobile, like that. They can, harm others or they can hurt themselves. They can cut anybody with the knife also. While
Okay.
is one of the major symptoms. So your patient is right now not in autism, doctor.
Another thing I would like to ask is the patient has actually come for treatment of cold and cough. Okay, not for the treatment of the delayed milestones. Okay, the parents told me that they have taken Ayurvedic treatment few months back and that was helping him. But then for cold and cough, they feel that homeopathy is better, so they came to me. Okay, now they want to continue with both the pathies. Now, what answer should we give to such a kind of patient?
If I would be at your place, I would suggest the parents to go back to Ayurveda and get treated there for cough and cold also. Because I am not interested in small symptoms. I'm interested in something major jackpot. So if I can give your child a new life, give me that opportunity to provide him a new life. About cough and
Correct.
cold, anybody can clear. but I am, I want the big things. I don't like to treat small symptoms. It would be my answer. Because the first thing is that, Dr. Alka, the major, I would say, drawback in the society is that usually they do not consider that there is speech delay. They feel that, लड़के तो थोड़ा लेट ही बोलते हैं. Boy speaks late. How much late? 5 years, 6 years, 10 years? No. There is no limit for late. But boys talks late, so we were waiting for, my parents said that he will talk when he will be by 5 years. Where is it written? In which medical book it is mentioned that when the boy will be of 5 years and he will start speaking? And the truth is that you get more patients of autism are male. There is a ratio of 1:5. Women are spared because of estrogen and progesterone. So please convey your message to the parents that we cannot give homeopathy along with Ayurvedic because our concepts are different. Either you finish that treatment and come to me, or finish my treatment and go back to the doctor. Yes, but with integration, we can go with allopathy in any case. In any case, we can go with allopathy just by maintaining a gap of 1 hour. Because I have a lot of patients I am treating in ICU. So they are already admitted. But
Correct.
still, with homeopathy, they get better results.
Correct. Thank you, ma'am, for your insight. It was really useful.
Thank you so much. Is there any
I-
more questions?
I think there are
Uh,
few in the chat
Excuse
box.
me. Good evening, madam. I'm Dr. V. Padmajarao from Hyderabad. So
Hyderabad.
I it was really a very good session, madam, but I have just missed half of the session due to my clinic time. So
Okay.
I've joined very late. So I'll go with the recording also.
Yes,
And
please.
madam, I already attended so many sessions of you before also. I was very much happy with your autistic cases and everything, sir. I learned actually when to give them anti-miasmatic, something like that. Some 10 years back thing I was telling you.
Yes.
And now recently I had a case, madam, from some 3 or 4 months back. So the child is very normal child of so now he is about 12 or 13 years age. But since till 6 years or 7 years, he was a normal child. Nothing, no problem with him. After 7 years, so his father has been died in a lorry accident. Immediately, his mother went into some depression and some 6 to 8 months. So they put him in a hostel. But he was good in hostel also. He was in hostel with his elder brother. He was not alone. So from that time, he started deteriorating. Now what happened? Actually, he is in 40 kgs weight or something. But within an year or two, or maximum 3 years, he became 90 to 100 kgs weight. And all his testosterone levels are very high, and mistakes has come. All the secondary sexual characters are very high. And if we see that boy, means we will think that he is at least 20 years age, like that. But he is only 13 years age now. So, and now what the problem is, he cannot speak also. And what he speaks is understood only by her mother, and he hurts himself by putting his head into the wall and everything, and he will be hurting very badly. And sometimes he will be very aggressive with the mother. He will be just beating and hitting back and blue mother also. So only mother and that person is staying there at a remote place, remote village. So they have approached me. So I have started medication. So I've given 1 dose of the indicated medicine, but immediately what happened? Some ulcers have come upon his body, and they have started suppurating and everything. So I asked them to wait. But what happened? So this person is not able to wait and everything. So they wanted to stop the medication, or they wanted to come to get for another. So I have given him only placebo for 3-4 months, or I think 5 months. I have given placebo, but even with placebo, the reaction is not stopping. So the person doesn't know that I've been giving homeopathy or something like that. He is good in taking medicines, and he is not resisting the medicine, and the mother is also not resisting. So that means they don't have any anti feelings for the medicine, so that I'm taking medicine or something like that. But and after 6 months, she just stopped coming back. So how would we see in these cases? Even placebo is giving the reaction. So how would we go forward in such such cases? Sir?
Dr. Padmaja ji, first of all, I would correct you here. This is not the reaction. This is what you wanted. This is the suppressed sora which is coming out on the surface after your medicine. If they will continue the medicine, they will definitely get benefit from you. Understood? So skin eruption was not good. Just explain them that this is the way how the cure works. This is the direction of cure. And you just suggest them to apply coconut oil or olive oil 5 to 6 times on all over the body. By the way, can I ask you the name of the remedy which you prescribed to this
I
patient?
think I don't remember, but I think it's a sulfur, madam. Sulfur 200. To start the case, I have given sulfur 200. Huh? So
Case has
not
began,
the.
yeah,
Hmm.
this case has begun after the trauma. This is post-traumatic stress disorder, actually. He lost his father, his mother landed in depression, then there is separation from the home, and he had to be in the hostel. So his conscious mind accepted that, of course, but subconscious mind disturbed his endocrinology. So my suggestion is that in such cases, you should start with high potency of Medorina because
Hmm.
your patient is in giantism right now. That's why I'm
Hmm.
suggesting Medorina. So
Hmm.
if they are coming back to you, do not go on the Medorinum immediately. First, give him some remedy for his skin eruption. Relieve it a little bit. Do not suppress, just relieve it. And then go for Medorinum 10M and again renew the case and see you will get the success.
Yes, yes. And actually, I have explained all this to them that this reaction is this kind of this one is very good, and you need to wait and apply all coconut oil, something like that. But what happened is that pus formation is very this one, so he became very weird with that one. That's why he became very weird, and he started beating all the other people also, and so she is not able to control that much heavy person. So that
Somewhere
is why they stopped. Hmm.
Ma'am, it means somewhere, though the sulfur, arose the latent sura, but it has disturbed his psychiatric level. That's why I
Okay. Hmm.
suggested you Medorinum. Medorinum covers
Hmm.
psychiatry also,
Hmm.
giantism also, endocrinal crisis also, and the pain, the transgenerational or, the injury, emotional trauma also. So in such
Okay, okay,
cases, either start with Medorinum or opium high potency to address
okay,
psychiatric level first, endocrinal level first, and then you can say, meanwhile, for such issue like skin eruption, give some potency, give some medicine in LM potency, but that is a
okay,
different acute remedy. Your chronic
mm,
remedy should be different, which
okay, okay,
should be anti-miasmatic, right?
okay, man. Okay, yeah. If they had turned up to me, then I will note this in my case sheet and
One
then
day
I will.
they
Thank
will
you
get
so
back
much.
to you one day, don't worry.
Yeah. Yes, 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 madam. I'm waiting for them. Thank you so much. Mm.
Ma'am,
Yes,
I have a question. I'm Dr. Vaishali Bide. I
go
wanted
ahead,
to
ma'am.
know, hi, hello, ma'am. How much quality research or documentation is being done with regards to homeopathy and autism? Because as you just showed the case, you saved the life for the child and the mother and the entire family. So,
I'm having
is there credible documentation or research papers coming out?
Yes, I have a lot of documentation. All these cases are published in all international peer review journals. And I
Yes.
have all the cases evidence based with before and after treatment. Psychometry reports are there. And all these documents are ready, which I will publish in my book,
Hello.
which I will, did you not hear?
I heard, I heard.
Okay, which I will publish in my book. My book is coming up about autism. But before that, I recently published 3 more books. So, and fourth is on the, on the verge of publication. So
Great.
when we publish that book, the autism book will be coming in June 2027.
I'm extremely happy that you are in this research work because we all homeopaths on international level we fall short because we don't document and enter research. So
That is,
great.
actually our lacuna. And though we, Dr. Vaishali, let me share my experience with you. When you share such cases or documentation with anybody with higher authorities, they get published in their names. It
Right.
happened with it happened with me. So now I stopped publishing my cases with any higher authority here. I'm just collecting all my data, evidence-based cases. I'm getting published them in the international peer review journal so that they become validate. And then now I am summarize them and I will publish my own book. so that nobody can steal my data.
Is there a government research or documentation?
No. I already told you my experience.
Yes. Okay.
I don't want to give
Nothing,
credit to other.
nothing through CCRH or any homeopathic body. Okay.
Nothing.
Okay. Okay.
Nothing.
Thank
So
you.
one day we can, with you or with your forum, we can make our own research institute.
Oh, yes. That would be such a good idea. Yes.
Yes, if you are willing, I can definitely support you and we can start it because I have experience in research and everything. I have lot of researchers, international researchers with me. My international research work got published with Dr. Michael Pratt. So
Okay.
we are working together. So
That's
we
great.
good guidance also.
Great. We
Excuse me, ma'am,
should.
but
Yes.
for a researcher, ethical clearance is a big issue, ma'am. So we need some
That's
institutional
I
backup.
told you,
Oh,
Dr. Rekha, my interest is not in showing my work and people should admire it. I don't care that.
yeah.
It is in treating the children and saving the society.
Okay.
It doesn't matter because I
Yes.
tried that and then my
Yes.
data got, stole by somebody else
Yes.
and somebody else published my cases and my work in his own name. Such a
Oh.
big doctor from Mumbai.
Hmm.
So I understood that this is not my cup of tea. I don't need any government validation, nothing. Why do we need that? We are healing people. We have to
Yes.
create the healing. We are saving children. We are transforming life. That is enough for me. I don't need their validation.
Ma'am, it is not for your
Correct.
validation. It is to put homeopathy on the international pedestal, actually.
Homeopathy is already on the international,
Okay.
level
Yes.
exponentially.
Yes.
But the
Yes.
problem is that not only in India, but everywhere they are putting it at the high level. But still, the reality is that homeopathy is getting extinguished from Europe. Only India is leading in homeopathy.
Yes.
Yes.
Ma'am, now when I'm working on a cancer book, I'm making sure that there is a PET, MRI, all the papers in place to prove that we are a scientific so that the next generations have something to look for.
This is evidence-based work which I am doing.
Yes.
So
Yes.
so my suggestion is that just collect your data and publish your own book.
Yes.
Publish your all evidences in your own book.
Okay.
Because my experience said when you share something with anybody, they publish it with their name.
Okay. That's sad, actually. Quite sad.
That is
Yes.
sad, but that is, that is a lesson for me.
Yes, that's a trend.
Thank God I shared only one case.
Okay.
That's good. Now and that man taught me to work out of India. That is how I became international. Okay, thank you everyone.
Thank
We are
you so
running out
much.
of time and thank you for understanding due to the technical issue. Dr. Alka ji and
Yes,
Dr.
yes.
handled it and they accepted my request about Zoom. Thank you so much. I'm quite comfortable with Zoom.
We have few more questions in the chat box. Can you answer them in the group? Ma'am, if you
Not in
could
the
just
group.
go to the
Dr. Rekha,
in
if you leave me just now, you will lose me. So what?
Yeah, if you can give 5 to 10 minutes, you can
5
answer.
minutes, yes, of course. Please ask.
ma'am,
Yeah.
should I ask you those questions?
Please.
Yes. First of all, someone has asked, please explain gigantism rubric here.
What is this? Like, are we doing here first year or second year? We are talking about a concrete subject. For small rubrics or for, if I use any word in our conversation, are you going to ask me about those rubrics? It is, at least do this work. This is the problem. When we deliver any webinar or seminar, people want everything ready. Please do not ask for everything. Try to search, try to, dig for yourself. It will increase your knowledge. I can answer, but why would I answer?
Yes.
When you are hungry, you eat by yourself. I'm not eating instead of you. Next question, please.
Ma'am, Shalini Gupta has asked, is there any role of mobile radiation in such cases?
Absolutely not, madam. This is a myth that mobile radiation or mobile screen watching time is creating autism. Autism were there even before mobile. But it, unfortunately, there were no diagnoses that time. So it has nothing to do with that directly. But yes, all this pollution, this 5G or electromagnetic frequencies, radiation, they increases the oxidative stress. And this oxidative stress increases the degenerative changes in the body. This is how it's not like that, but it is like that. So ultimately, it is damaging our immunity, but it is not harming or creating autism directly. There is no relation between screen watching and autism. It's a myth.
Ma'am, what is the direct reason because of which the autism cases have increased?
Yeah. Two reasons, Dr. Vaishali. First is the emotional trauma to the mother during pregnancy. And second is the environmental factor. In environmental factor, we have the triggering factor, like vaccination, which is one of
Yes, you
say,
mentioned.
around 60-70% cases I know, and I observed, I have evidences, I have worked on that vaccination creates autism. Then radiation like MRI during pregnancy or any the pregnant woman standing near MRI room or in the MRI room, that also causes. Then lot of intake of drugs, automobile inhalation, this pollution, then newly painted walls for the children. Usually this is the culture in Peru and Colombia country. They welcome their child by newly painted wall. They paint the home, and this newly painted wall give lead poisoning to the child. In India, the kajal, which we put, काय म्हणतात त्याला मराठीत काजळ, काजल, उससे भी होता है.
Kazal.
Yes. So please avoid this thing. Basic original autism is not only emotional suppression of mother. It is because of the mixed causes. First is emotional suppression of mother, then environmental factor, vaccination, radiation, automobile inhalation, lead poisoning, heavy metal toxicity. So many things are there.
Ma'am, the mothers are always emotionally in trouble for centuries together, but we didn't see so much of autism. The only drastic change has been the vaccinations, which have
Yes.
increased at
But
another rate.
vaccination is a triggering factor, Dr. Vishal.
Okay, okay.
It's not basically causing. Autism is an epigenetic disorder, and always the child who is in autism gets autism during fetal life. This is
Okay.
fetal life disorder.
Okay.
And it is a silent disorder. But as soon as you get some triggering factor, the exposure of triggering factor, immediately the child starts showing symptoms. And this is how we get the diagnosis of autism only after the age of 18 months. Before 18 months, you cannot diagnose autism. I never saw any case.
So, if we would use the medicines under ailments from vaccination to start with,
No, it's
it's
not
just a
possible
hypothetical
in every
question.
case. No,
Yes.
no, it's not possible, Dr. Vaishali, because you are talking like a protocol, but we
Yes.
cannot go with the protocol.
But if you're so sure that is the triggering factor, why can't that be
It's
used?
just the triggering factor, but not the elementing factor, dear. Elementing factor is mother and her cycle.
Okay.
And not only during pregnancy, even before pregnancy, the time is quite crucial. Even before pregnancy, the mother or father has consumed lot of drugs, or they have used nasal spray throughout their life. Still, the child may suffer from autism. If there is lot of intake of antibiotics, anti-allergics by both of the parents or any one of the parents, especially by the mother, then you will get the child landing in autism. Okay?
Thank you, ma'am. Thank you so much.
Take care, everybody. I hope you enjoyed this session. We will soon meet with a new agenda, and Dr. Vaishali will work on the research institute now.
Yes, ma'am. I'm very eager. Thank you so much.
Okay? Okay. Okay. Right.
Thank you, ma'am. Thank you, audience, for being there with us. We'll meet for a
Thank you.
very beautiful discussion on diabetes on the 20th. Yes, so please be there for that. Yes, thank you, ma'am, for being here. We are really thankful to you, and we would request you to take many more sessions with us and give us, or rather, share all your knowledge that you have. And we would be eager to learn. Thank you very much, everybody.
I
Good
would say,
night.
Dr. Alka, instead of saying rather share your knowledge, just say exchange your knowledge. Because I also want to learn something from everybody. So that's why my sessions are interactive. So let us talk with each other. Sometimes
Yes,
without
certainly, ma'am.
just question answer. Keep one round of only question answer. Different question without any syllabus. Okay? Yes?
Yes, ma'am.
Thank everybody. Good night.
Thank you so
Thank
much.
you so much, ma'am.